Dear distinguished colleagues, partners, and friends, I am Dr. Tresa Kasayeva, Director of the WHO Global TB Program, and I'm very pleased to welcome you to this important online talk show to commemorate World TB Day. This is a sobering time as the world grapples with the COVID-19 pandemic. We stand in solidarity with those affected and those at the front lines of the fight to combat COVID-19, as well as those who continue efforts to support those ill with the long-standing health problems like TB, HIV, and other diseases. We have organized this event to ensure a spotlight in the midst of the COVID-19 crisis for the 4,000 people who lose their lives to TB, a preventable and curable disease each day, and the 30,000 people who fall ill with TB daily. Under the theme It's Time, the focus for World TB Day this year is on accelerating and continuing TB response to save lives, to end suffering. Building on all our previous committing, there should not be excuse to stop, because we should look at the faces of those who are suffering and dying from TB, and now we are all facing another challenge. This is a pivotal moment for the global fight to end TB. It's critical that the commitments and actions emerging from the high-level meeting are sustained and realized at national and local levels. We announced last year that more people received life-saving treatment for tuberculosis in 2018 than ever before, largely due to improved detection and diagnosis. Globally, 7 million people were diagnosed and treated for TB, up from 6.4 million in 2017, enabling the world to meet one of the milestones toward the United Nations Political Declaration's targets on TB, and the Director General flagship initiative Find Treat All to end TB, jointly with the partners Stop TB Partnership and Global Fund. This is a big win for the TB community, and despite of all the challenging, we will not step back. We are working with the countries to roll out important guidelines, including a comprehensive package on TB preventive treatment, which we are launching today, updated MDR-TB guidelines to promote the use of all oral regimens for the patients with a drug-resistant TB, which would be helpful, particularly at this point when visiting of health centers is a challenge. Furthermore, WHO has developed a note on TB and COVID-19. All of this is available on our website, the link to which is posted in our video. We need to stand in solidarity. Any slackening of commitment and action would impact efforts towards universal access to TB prevention and care, and ensuring no one is left behind. Dear friends, it's time. We can't choose the time, but we can choose our position, and we should definitely continue our efforts and even strengthen them. We are calling on countries, health workers, partners, civil society, those affected, and the community to unite forces to keep the promises made. This is why I am very pleased to welcome our distinguished lineup of speakers today. They are powerful voices for the fight to end TB and include TB survivors and advocates, civil society, high-level government representatives, heads of agencies, researchers, and partners. We plan to have a very interactive format. It's a new format, and if you have questions, please tag WHO and use the hashtag #MTB to send us questions, or send it via the comments section. To start this one-of-its-kind talk show, I'm very honored to welcome Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization. Dr. Tedros, thank you for making time to join us. We know how extremely busy you are leading the response against the COVID-19 pandemic. We would appreciate your opening the talk show by highlighting how we can face down TB in the time of crisis to ensure health for all. Dr. Tedros, can you hear me?
Thank you. Thank you, Teresa. I think I can say everybody is lining up. Very nice to see you.
Full house, full house.
Hello from Geneva too. So I should start by saying good morning, good afternoon, and good evening to colleagues all around the world. And thank you for joining us. Today, as you know, is World Tuberculosis Day. As we stand together to confront this COVID-19 pandemic, it highlights just how vulnerable people with lung diseases and weakened immune systems can be. Millions of people around the world suffer and die from tuberculosis, a preventable, treatable, and curable disease. We must keep the momentum going to stop the spread of this ancient disease and reach those affected with the care they need. Countries should scale up access to TB preventive treatment and transition to all oral regimens to treat people with drug-resistant TB as recommended by WHO. Further, we must do our best even in this time of crisis to close gaps in care as part of the global drive to achieve universal health coverage. This will require concerned action by all stakeholders, sustained investments, and intensified research. Importantly, we must stand against stigma and discrimination, and we must work together with civil society as a key partner in achieving our goals. I would like to end by reminding everyone that tuberculosis remains the world's deadliest infectious killer. Tuberculosis kills more than 4,000 people every day and 1.5 million every year. The world is now responding to COVID-19 with urgency and purpose. This shows that we're capable of when we come together against a shared threat. Today, we're calling on all countries to come together with the same urgency and purpose to end TB. It's time for action. It's time to end TB. Thank you.
Thank you, Dr. Tedros, for your very inspiring opening for this talk show. We appreciate your leadership and support, and we, your team, are always next to you to serve to the most vulnerable in the world and continue our fight against epidemics, threats, new and old. Thank you very much.
Thank you, Teresa.
We now move, I hope that Dr. Tedros will stay for some time. I know though you are busy, but if there will be chance to listen to our excellent speakers, it will be good. But now we move to our speakers on the line. The format we will follow is this. From our list, we will do a round of questions with a set of 6 speakers on the line and then move to the next. But at the heart of each discussion, we will have with our speakers those who are battling daily against TB, those who are at the front lines of the new and old epidemics making a difference. This is why I am very pleased to invite our first speaker, my good friend, passionate warrior, Nandita Venkatesan, to set the stage first. Nandita is a TB survivor and a powerful advocate who was a lead speaker at the UN high-level meeting on TB. And my question to Nandita, please share with us and with the whole audience your personal experience about your battle against the world top killer and how you have not only overcome the disease, but also found courage and made difference in the lives of other affected. Please, Nandita.
Thank you, Dr. Teresa, for having me. Am I audible? Okay. Thank you, Dr. Teresa, for having me on. We are conducting this webinar, I must say, at a very crucial time when the world is dealing with two big infectious diseases, the COVID-19 as well as tuberculosis being there. I'm personally a TB survivor, and now I'm a very active advocate for the disease. I survived a very long battle, as probably many people in the panel would be knowing, that I survived a very long battle against 2 rounds of intestinal tuberculosis. And I first contracted this disease when I was 17 years old in 2007 as a young undergraduate student, a very ambitious undergraduate student. And back then, even the sensitive forms of TB did not have, it needed a very long treatment. And I took treatment for close to 18 months. And I was declared cured, and I moved ahead with life. Then the TB revisited me. I had a big relapse in 2013, and in the course of getting treated for the second round of TB, I had to undergo 6 major surgeries in my abdomen. I was in isolation, quarantined in the hospital for 2 months, and I ended up losing my hearing completely because of the kanamycin injection that was given to me for close to 200 days. And this came as a very big shock to me, and I was pushed into depression, acute clinical depression. I was diagnosed with clinical depression after that, and the battle since then went on for 4 to 5 years after that, and it took me a while to pick up the pieces of my life and go ahead. Today, I must say that yes, I have moved ahead, and I have been trying to do my bit, contribute to this cause as much as I can. Me and other TB survivors, we have been actively pushing for the injection-free regimen to be implemented by countries to follow the revised WHO guidelines. We have also been helping TB patients. I and another survivor in India, we have a network of women TB survivors who help TB patients, especially drug-resistant TB patients in India, to help them navigate through the treatment. I was also the opening ceremony speaker at the UN High-Level Assembly. And I want like to add a couple of points here that leaving aside my own story, just yesterday, a TB survivor messaged me and asked me that she just told me that, Nandita, we TB survivors are a disease magnet now, meaning that she is fearing that is she at a grave risk of contracting the coronavirus infection. I have got these queries from a lot of lung TB survivors, and they are fearing whether they are an at-risk population. And we need governments, we need the WHO to proactively address these concerns. We need to see that TB drug supply isn't affected because of the current pandemic, or the supply of drugs, diagnostics, and we need clarity of information from the national TB programs on what should TB survivors and patients right now brace for with respect to the current pandemic. What should they do? How should they protect themselves? What additional precautions should they take? I hope that this webinar serves, this webinar sort of thinks over some of these points, and we have at the end some guideline towards what has to be done, because TB, especially pulmonary TB patients, their lungs are already affected. So, and if the coronavirus, by God forbid, anyone contracts because they are immunocompromised, what are they going to do? Are they going to be left to fend for themselves, or what should they do? I hope the webinar going forward thinks about these points, and we bring out something on this.
Thank you very much, Nandita. Your speech is heartbreaking and in the same time very inspiring. How we can give up once we have such a passionate warriors and fighters. against TB. And your questions you raised are absolutely relevant. That's why we tried as soon as possible address some of them based on the evidence we have. And if you look at our information note, we're highlighting that TB patients and people infected with TB are definitely among vulnerable, and we should pay special attention to them. We should provide continuation of the treatment and all the services. And that's why, thanks to the new option, the treatment could be easy taken at home. We are requesting to provide drug supplies at home for at least 1 to 2 months, and it should be done as soon as possible. Also, TB preventive treatment with at least 5 different options, affordable treatment, will be another step to protect people infected from the development of TB, at least, to avoid the situation with the comorbidities. So that's why let's stay in touch. We're waiting for your information, for your highlights. Let's exchange information, be close, and give better advice to those who are waiting for them. Thank you very much, Nandita. And now I would like to move to another speaker, a very special guest also. In our, all the guests are actually special, eminent, Dr. Hans Kluge, recently elected regional director of the WHO European region. WHO European region, as we all know, facing with extreme problems now with the COVID-19, and WHO regional and country offices team jointly with the country officials are doing great job. I know, Hans, you yourself, you are very passionate, and you are involved personally in all the activities and in all the discussions. Please, we're looking and waiting to hear from you about your experience in the country. What is the current situation and how you're managing, doing your best to provide access to the services to all who needs it, including people with TB, following our vision, no one should be left behind. Dr. Hans, floor is yours.
And I remember Miss Nandita also very well. Thank you so much. I'm always very inspired by your words. And indeed, we are working 24/7 on the COVID-19. And there was, I think, a message on the Facebook that some TB workers were concerned that we are too overwhelmed to acknowledge this. And I wrote immediately, in the WHO European region, we will never just pass by the World TB Day, because this is so important. As you know, Dr. Tresa, I have been working in some of the most challenging places on earth, including when I was with Médecins Sans Frontières, 2 years in the prisons in Siberia, also with TB control in Somalia during the civil war, in Myanmar, into North Korea. So the vulnerable people have a particular place really in my heart. In fact, we just published the first and only guidelines on the COVID-19 response in prisons, which is a very important target population. And we also have, as you know, the WHO Collaborating Center on TB in prisons in Azerbaijan. Coming back to your question on a particular country, we are discussing with Dr. Masoud Dara and the team on Belarus, which in fact symbolizes the huge diversity in our region, because you have low incidence, medium, high burden. Belarus is a country which managed to keep the strong features of TB control of the Soviet Union, like, for example, universal access to primary health care free of charge, but incorporating new evidence-based approaches. And they succeeded to go for a NDR-TB treatment success rate from 42% to 84%. So it's a doubling through applying really also the new treatment regimens. And Belarus has now the first WHO collaborating center on new TB medicines and treatment regimens. We're also very grateful to the Russian Federation, who hosted the Global Ministerial TB Conference, where I was personally present. And I had promised Dr. Tresa at that time that if I would become the region director, it would be a priority. And the first country mission I did when I was approved and sworn in as RD in Geneva at the executive board was together with Dr. Tresa go to Central Asia, to Uzbekistan, to Kazakhstan. We met the presidential administration, the prime ministers, and advocated for communicable disease control. Sunday, I was talking to my good friend and mentor on TB control, Thomas Frieden, who also did a great job in New York, in India, and we are discussing on COVID-19 approaches. And ultimately, we agreed that the strong case management, which we learned from TB control, is applicable, whether it is for COVID-19, for hypertension treatment, because ultimately it's case management, putting the people in the center. Tom taught me the VIP is the patient, and the more vulnerable the patient, the more VIP is the patient. This is my vision for Europe. It's called United Action for Better Health. United because we have to do it together. I also see Lucia from the Stop TB Partnership and many friends over there, the civil society and action. WHO has to move from the what to the how. And rest assured of my full support to the TB, the MDR TB control through a unique partnership which can benefit also chronic disease management and communicable disease management. I'm very proud of my own team here under the leadership of Dr. Masoud, of the team of Dr. Tresa, all of you connected, because ultimately we see it in those days, any action in one country impacts on another country. COVID-19 is a test for solidarity and psychological resilience, and in TB control, we are trained for that. Thank you so much.
Thank you very much, Dr. Hans, and I am very proud of our collaboration, of the acting as one WHO team as requested by Dr. Tedros. So we will continue definitely do this, and we can see clearly in your region how countries can benefit from the strong TB programs. And I know that in your region, especially, many TB programs and specialists are heavily engaged in this COVID-19 response. And no doubt, despite of all the challenges, we will succeed. Thank you very much, Dr. Hans, to be continued, and including our strong collaboration. And dear colleagues, I would like to pay your attention that Dr. Tedros is with us. We are very happy that he's listening very careful to all your statements, to your concerns, Nandita, you expressed. So, and we will definitely to find solutions and responses. Thank you very much. And I would like to pay your attention also that our audience is growing. Now we have more than 400 followers with us. I hope that we will have much more. So now let's to move to another special guest and special speaker, my very good friend and colleague, Dr. Nguyen Viet Nam, head of the National TB Program from Vietnam. I would like to ask Dr. Nguyen on the example of Vietnam, tell us how you are managing in this extremely challenging environment to provide continuation of the TB services and, in fact, effective pushback of the epidemic of the coronavirus. I know that you are among pathfinders in the fight against TB. You are among the first countries to immediately translated commitments of the high-level meeting into actions. You are personally involved in the guidelines development process and their soonest implementation. Please, Flores, tell us more about your unique experience. Thank you.
Hello, everyone. Thank you, Dr. Tresa, for introduction, a very kind introduction. Thank you for the opportunity to tell you some experience and some information from Vietnam. Today, World TB Day, we just organized the online event to the Laos country with more than 1,000 people engaged. And I think that is a very special meeting so far on the TB history in Vietnam, but very successful. And the first I would like to emphasize the very important for the TB control that the political commitment. In Vietnam, we achieve, I think that is quite high the political commitment by established national commission by the prime minister. It just come out last year, and we just have a first meeting of the national commission. It's chairing by the deputy prime minister, and with the 20 other member from the many sector, like the government and the union. All the government ministry relevant, like Minister of Health, the Planning, Investment, Finance, and Molisa in the police and military, and many sector, and women union, farmer union, and of course the NTP manager as a member, like the technical member. And we achieve a lot of things. This awareness to the own population and on the authority in the country. I think that is the starting point of the new era for the ending tuberculosis. And secondly, we see the most important challenge, the biggest challenge at the moment in Vietnam, and I think it's other country, that the missing cases. We still missing a lot of cases in population and not yet detected, not yet treatment, so that the mortality is still high. So how to detect more the case? We apply the two strategy, that innovation of the technology and innovation of the approach. In technology, we are going to use expert like the initial test as recommended by the WHO recently, and we use double X strategy, mean that the X-ray, pulmonary X-ray for the screening on the suspect cases, and then the expert like confirming TB cases. And for the treatment, we apply the precision medicine, mean that we need to know the status of the drug resistant case. If it's not non-resistant, we can provide the first line drug, and if the multi-drug resistant, we can use a short regimen, and oral regimen is applied. And if the second line drug resistant, we can provide a new drug like a glycerin based regimen, but not enough. If the technology, we need to bring the own technology to the field that the people need. That we apply innovation of the approach. We do with the active scale fighting for the key at-risk population, and we do intensified case fighting in all the hospital and health facility, and also we apply the integration service of the TB and the other disease like NCD, asthma, COPD, pneumonia, hypertension, diabetes, and so on. So that is the two innovation we apply for the take on the case in population. And thirdly, we think that the COVID-19, that is the crisis. But in Vietnam, we see the positively. And thank you, Dr. Teresa. I think we think the same. That is time is to push the TB control in the population. We see that for the COVID-19 response, it's quite similar to the TB, like the contact tracing, or let's say the active scale fighting, and the infection control, and the many intervention is similar. So we try to respond to COVID-19 very early, like develop the guideline and make the intervention, provide the technique for the the needs, like we deliver X-ray mobile car for the service of the COVID-19, so that we get the awareness. We get the recognition of the population, and we that's why we take the topic of the World TB Day this year, that we take the COVID-19 crisis as an opportunity for Vietnam to end tuberculosis by 2030. That is topic already disseminated by the mass media today, and I think that within this week. It's very strong information. And if I can tell you that the three number, the number one is the first political commitment, that the commitment to end tuberculosis. The number two, that the two innovation of the technology, innovation of approach. And the three, that the three advocacy for the communication. That means the communication, communication to the population, community. The second is the social mobilization. And we get on the authority, we get on the union, our own society involvement in the TB control. And number three, very important, that mobilize the international support. That is the three number I would like to tell you. Thank you very much for listening.
Thank you very much, Dr. Nguyen. Can't agree more with your points. Especially, I like your slogan, let's transform our challenges into the opportunities. It's very timely and right slogan. I fully agree with it. And you demonstrate actually amazing work and example of the effective management. And I think that Peter Sands will also agree with me, maybe because of this effective approach, they increased and strengthened their support from the Global Fund to your programs. And definitely it's the right way to attract additional resources also from the donors and partners. Wish you all the best and looking forward to your excellent example of combating now also with the COVID-19. So you touched very important and painful problem of the community, global TB community, problem of missing people. We are spending a lot of efforts, joint efforts, all the key stakeholders to close this gap. And we actually succeeded last year, made significant step forwards, but still we have 3 million missing people. And now we have new challenge. Avoid again turning back and further growth of this number of missing of excess people. And with these concerns, with this question, I would like to address my next question to the next speaker, very special again. It's my good colleague and friend and sister, Dr. Lucia Ditiu, Executive Director of the Stop TB Partnership. We are together from the early morning. We start our town hall discussions with the regions. We had already 2 rounds, and these discussions will be continued after our talk show. It's the whole day of marathon against TB. So, Lucia, Flores, could you please share your ideas, your thoughts, and address the community with the urgent needs? What should be done together? What is your experience to avoid this growth of missing people? Please, Lucia, floor is yours.
Thank you very much. It's really good to be here, all of us. It's not a normal World TB Day, as we said. Since morning, as Teresa said, and I'm very impressed with Dr. Tedros spending the time with us and listening to all the things we say. Since this morning, we were able to link to 200 people from all around the world, from Asia, Europe, and Africa, and discuss basically the impact that TB and COVID, interaction will have on our lives, but more important, on our targets. So we miss people. We were on a good track. I hope we remain on that track to find most of the, hopefully by the end of 2022, all missing people. We have this great, with TB, we have this great initiative together with Global Fund and obviously WHO, the 3 of us, Find, Treat All, to be able to find everyone with TB. And as Teresa said, we were on good track. This morning, Dr. Sachdeva, that I think will also mention here, so I will not spoil the beans, spoke about some amazing achievements that took place in India. So we had a lot on what to build up. But unfortunately, I would say we are faced now with a more acute situation, I would say. that we have in a way to do a double battle. And, you never know with whom to fight first, but we have to face it. I am concerned that the situation with COVID that we are seeing ourselves in, there is a continuous increase of the number of cases from one day to another. I think we are almost at 400,000 now, is very, of course, impacting the TB program. I appreciated very much our colleague from the NTP, Dr. Ngoc from NTP in Vietnam, on the need to be focused and to have the right guidance. From the discussions we had this morning, we noticed that NTPs and teams around them dealing with TB in some of the highest burden countries, specifically India, Indonesia, Philippines, Pakistan, and Bangladesh. These 5 countries together represent a high TB burden. Put it together guidance for their programs to ensure that there will be continuity. We will not be able to achieve any of our targets if we are not able to ensure that people with TB is very clear that they represent a specific vulnerability for COVID-19. Actually, in South America, in 2 countries, the first ones that died were people that were co-infected, having people with TB that got COVID on top, which is basically what you, Nandita, mentioned. So we need to, we are also ensuring that the testing for TB goes ahead. We will have now X-ray, and we have as well the recently launched Cepheid Gene Expert product cartridge for COVID that will use the same machine as for TB. So we need to make sure that on one hand, testing goes ahead, the testing for COVID is scaled up, but also that TB is not left behind and that people think in the same way about the TB as well. We are trying to see and ensure that from the Stop TB side, even though we work from home, there is no operation stopping. I want to reassure Nandita and everyone that is from the TB survivors on the call that the colleagues and the team of GDF is monitoring very clear any possible disruption of supply of drugs and diagnostics. We had a team that did this since January. We went over the China situation, but we are obviously facing now increased challenges with India going in lockdown, as well as basically no airlines or very few airlines flying. So the transportation by air and sea is not easy. So far, things are under control, but of course, nobody can predict the future. I just want to say that TB symptoms are very similar to the ones with the COVID. The tools that we have, meaning specifically the X-ray and possible using the Gene Expert or others, should be deployed in a smart way that we continue finding the people with TB. Basically, I would say a dual testing, people that come with a dry cough. Okay, I am infected with TB. If I have a dry cough, if I feel weak and fatigued, and if I feel fever, I can be anything. So it's very important people to keep this in mind. The same thing is for the treatment. It will be insane for us to ensure to ask for any type of DOT. We need to make sure that people, as Teresa said, are flexible, ensuring provision of drugs enough and use for adherence. So I got a question today in one of the calls that I was a bit shocked. So what do we do if we don't ask the patients to come to the dispensaries to take the treatment every day? I said, listen, this is the year 2020. There is FaceTime. There are a lot of digital technologies that we are putting together in a paper that is coming out tomorrow. All the digital technologies that are available to be used to help in terms of communicating with people without asking them to move from one place to another. The last point, and I will finish here, I liked very much, not only that I see Dr. Tedros here, and maybe he has a little bit of time to breathe and take care of him as well. I'm saying this very, very, very seriously. Is not you need to take care of you as well, DG. But also what you said about stigma and discrimination. The TB people, the TB survivors went through a lot of isolation, a lot of distancing, went through a lot of stigma and discrimination. We cannot allow this to happen to people with COVID. We need to learn from each other, but we need to ensure that we embrace each other virtually and we stay in solidarity together. As I think you also mentioned, Teresa, that we will never be able to finish any of this without being together. Thank you very much.
Thank you very much, my sister Lucia, and you made very important highlights. Of course, we should avoid stigma, discrimination, and now we all see how important is it. We should provide access, and we have a lot of digital tools now. It's time to use these tools and put them into the practice, and of course, we should be joined. You mentioned also about lessons learned this time. We all learned a lot of lessons from this crisis and pandemic, but there are many positive lessons. For example, we understand that we can be effective and productive and focused even working in distance. We can be much closer if we're despite of the distance also. And we have an excellent round of very busy people and very high-level people who found time and to join this important discussion about millions affected by TB. Now with this, I would like to turn to another special guest and would like to give floor to Dr. Peter Senge, Executive Director of the Global Fund. First, I would like to acknowledge your wonderful piece in the Rotary yesterday. I was impressed how strong and clear was your messages, and I think the whole TB community will support these messages. Absolutely right and very passionate. We would like to ask you, Peter, about a role. What do you think? What role can Global Fund play during COVID-19 pandemic to ensure countries mitigate the negative impact on TB and safeguard the progress made in many countries? Peter, also as former banker and CEO, what lessons can we learn from the last global financial crisis? Please, you're welcome.
Thanks, Tresa. Let me start on your last question about the link with the global financial crisis. I was 22 months exactly into my role as chief executive of Standard Chartered, one of the world's biggest international banks, when Lehman collapsed. And as it happens, I was exactly 22 months into my role as executive director of the Global Fund when COVID-19 appeared in Wuhan. A number of my friends have said to me, warn us next time you switch jobs. There are many lessons to learn from the global financial crisis. One is that you have to go big. And until now, we are only just beginning to go big in our response to COVID. The sum of lots of individual national responses does not add up to the kind of scale and coordination one needs. And we really look to the G7 and G20, which showed leadership then, and we need that leadership now to deliver on a scaled response. The other thing that was very strong in the global financial crisis, right from the beginning, was a sentiment of never again, that we had to do things to the way the financial system of the world was structured, which meant that we wouldn't encounter the same kind of cataclysmic event. I think we need to have that same sense of never again. For far too long, we've been trapped in this cycle of kind of panic and neglect. Things blow up, we panic about it, and then the moment the excitement goes down, funding for epidemiology, public health and things all disappears again. The other thing I think we need to do as we think about that is make sure we break down the barriers between health security, which is emerging infectious diseases, new ones, the sort of the ones people get excited about, and the endemic diseases such as TB. Because the reality is that distinction doesn't really work. Both sorts of diseases kill you, and indeed many of the security threats, like MDR TB, come from the existing diseases. Turning specifically back to TB and the role of the Global Fund. As you say, we are by far the largest external funder of TB programs across low and middle income countries. And we gave a promise to the people affected, the communities affected by TB, that with the replenishment, with the success of the 6th replenishment in Lyon in October, that we would step up the fight against TB, that we would build on the progress in terms of closing the gap between those falling ill, the missing people, and those getting treated, that we would build on the progress of rolling out new and much more effective treatments for MDR TB. We said we would do that, and that we would accelerate the end of the epidemic. We cannot use COVID-19 as an excuse or a diversion to go back on that promise. I hear a lot of people saying, oh, our funding submission may be a bit late, or we can't get, lots of good reasons, lots of practical issues. I know some of the heads of NTPs are working, they're dedicating their time in hospitals, but the rest of us need to find ways of making it work. We need to continue the commitment to step up the fight against TB. Too many people are dying, too much is at stake. We have the resources. The amount we have committed for TB in the next 3 years is 2.3 billion. It's 23% up on what we had before. We should be able to drive a change in trajectory. That said, we of course have to recognize the change in circumstances. COVID-19 is a huge threat, both to the continuation of programs, to the people who are affected by TB, to the resilience of health systems overall. But we need to wrestle with that threat. And what we are doing at the Global Fund is a range of different things. One is we're very supportive of the things that you have described yourself, Tresa, and Lucia was talking about, which is risk mitigation plans. Plans in NTPs to adapt programs to the new reality and say, how do we deliver on our ambitions given the challenges of social distancing and all that kind of stuff. So continuing to deliver, but adapting to a rapidly changing situation. The other thing we're doing is we have announced flexibilities on our grants to enable countries to use assets already in place, savings from grants, and to some extent, reprogramming where it doesn't have a deleterious effect on current programs, to enable them to move quickly in responding to COVID-19. We announced those flexibilities about 10 days ago. 16 countries have already received assistance, and we are expecting that number to go up pretty rapidly. I think the interconnection between the programs and issues around TB and COVID-19 is even closer than it is with the other infectious diseases that we deal with, malaria and HIV. It's a respiratory infection. It affects many of the same marginalized, concentrated communities, people in slums, in prisons, and so on. Actually, a lot of the assets and technologies and capability that we use are likely to be useful for COVID-19 and for TB. A very good example is GeneXpert, as Lucia mentioned. So we need to work very carefully to ensure that, in a sense, we don't divert resources away from TB programs, but we actually build and make sure that both the COVID response and the TB response are effective. That's going to require some very dynamic management of a very rapidly moving situation. It's going to require, as we all are, rapid learning curves on how we adjust our model of operating to working remotely. But as I keep saying to our team, it's all about how. It's not about whether. It's about just, we want to get to the same place. We may have to get there in a slightly different way. So we are absolutely committed to continuing on the ambitious path of stepping up the fight and delivering on the goals for TB. We are also committed to supporting countries as they respond to COVID. I think the thing that we all need to be working on with urgency is the practicalities on the ground of how we're delivering a combination of a COVID response and a continued TB programming response, given, as Lucia pointed out, the symptoms are very similar. There will be a large overlap in the at-risk populations, and some of the assets we're using, like the diagnostic tools, are the same. But this is, I think it's great that we're having this conversation now, because we have made a lot of progress in TB, actually, particularly over the last couple of years. We have to build on and accelerate that progress. Now is not the time to get off track. Thank you.
Thank you very much, Peter. We are really privileged to have a financial person, leader of the Global Fund, at the same time, passionate TB advocate. It's really a unique situation, and thank you very much for your dedicated hard work and for the whole team, because we can see now the results of the work for many years. You try to do your best to strengthen capacity. You invested into the labs, in the strengthening labs and programs, and now we can benefit, and at least we can provide sustainability of the services. I hope, I believe that this work will be continued and strengthened, and we are also privileged to have other donors and partners as Usaid, Bill and Melinda Gates Foundation. They're all also next to us. So we are coming to an end of the first panel, virtual panel, and I would like to ask one final question to each of the speakers and hope to receive a very short and concrete response. What is time for? In line with our World TB Day theme, it's time. So please, according to the order we started, if possible, your responses. Nandita?
Can I say?
Yes, please, go ahead.
Yes.
As usual, Pathfinder.
Yes, it's time to end COVID-19 and it's time to end TB.
Great.
That's my word.
So it's not necessary in order. Who would like to be the next? Please go ahead.
I'll be very short. I would say it's time for no bullshit. It's time for us to act. And very often we measure 5 times before we cut once. And we always aim for having something very perfect in the place and everything aligned. I don't think we have the time for that now. So I would say it's time to act now and don't go too much in circles. Thank you.
Thank you very much. I'm wondering if Dr. Tedros is still with us. Maybe he would like to contribute at the end of this panel. So I can't see him, but he was still the latest moment in his office. I've seen him. Probably he will decide to join later. So, Dr. Hans.
Everyone, I learned a lot really. Time to double and triple the respect for our healthcare workers. 2020 is also the year of the nurse. I'm a great advocate. For the first time in 10 years, there will be an announcement of a chief nursing officer at WHO Euro. So great respect for our healthcare worker and the nurses. Thank you so much.
So thank you very much. And now we are waiting for the strong statement from Peter Sands as usual.
Well, actually, I agree with everything people have said. But the thing that I would focus on, and it's a little bit like Lucia's sort of cut the bullshit thing, is in a situation like we face at the moment, we have to be absolutely ruthlessly prioritizing on the things that save lives. So it's absolutely time to save lives. And if we save lives of people threatened by COVID, save lives of people threatened by TB, we don't waste time arguing about the finer points of this or that or whatever. We haven't got the room to that. So it's time to save lives.
Great. I would like to address all the colleagues, all the audience which joined us, that you should be sure that our amazing eminent speakers will definitely do their best to follow their commitments and put them into the concrete actions. Thank you once again very much for the wonderful panel. And now we are moving to the next one, which will be also amazing, no doubt. So I would like again to put the spotlight on those who are at the front lines. And we have health workers, we have nurses, we have officials, we have civil society community, but we have also young people. And young people is powerful force, those who potentially can be engaged much more in the fight against TB. Let me start by asking colleagues to play a special video developed by our next speaker, a very special young guest. Please, can you put video? Waiting for a few seconds. So seems that we had to go to the video a little bit later. And now we are moving to our next speaker, my young colleague and friend, Mr. Madhusudan Kaple, youth advocate and founder of the International Youth Movement to End TB. Madhusudan, can you hear me?
Hi, yes, thank you. Thank you, Dr. Teresa. It's my
great to see you. Hope you are safe and healthy. Yeah. I can see and can guess it according to your smile.
Yeah, we are good. Thank you.
Look, your fantastic video. But let's discuss. Let's talk. I still remember you reached out to us with the power of social media. And in a short time, you have made a dent in scaling up youth engagement, not only in Nepal, your home country, but in other countries around the world. It was really so impressive. I couldn't expect that the young boy from Nepal will have such an energy, very shy boy, but in the same time, very passionate and smart. Please share your amazing experience of the impact of youth, your work with youth, what differences it can make in our fight against TB. Please.
Thank you, Dr. Teresa. It's my honor to be here as a part of this great event, and I would like to thank WHO leadership, Global TB program, and especially you, Dr. Teresa, for great leadership even during the COVID crisis. It's my privilege to represent young people, young generation, and currently we are working more than 2,000 youth advocates across the world, and we have reached 10 countries already, and we aim to reach at least 30 by the end of this year, 2020 December. Yes, we use social media to form network, to communicate with our friends, to exchange the information, innovative ideas and intervention with each other. So social media has been a great platform for us to strengthen our leadership capacity also. And also, like currently we are focusing on advocacy in tuberculosis and using two major tools, guiding document. I believe these two strong tools, WHO 1+1 Youth Initiative, and another one is WHO Youth Declaration to End TB. With the support of WHO Global TB program, we are able to do all these things. And we have seen immediate result of these two things already. Recently, I really appreciate the leadership of Vietnam National Lung Association. Vietnam has launched National Youth Movement Against Tuberculosis, Vietnam. It's a great example of health system initiation, and we look forward to see such initiation from other countries also. We are working in Nepal with municipalities and community and with educational institutions. In India, we are working with young medical doctors. In Kenya, we are working with the affected youth group. In Indonesia, we have built a network of more than 20 youth organizations. Together, they work together in youth and TB agenda. And also in Philippines, young people have been mobilized as TB navigators. It's a great example. So the benefit of mobilizing young people is it's very cost effective. We can do lots of things with less money, and sometimes even with no money. We are being able to do lots of things. Another thing is it builds the capacity of young people. It builds the confidence of young people to become the leader of the society, to be the advocate and do advocacy at their community. And also, I strongly believe that it also ensures the accountability and transparency of organizations that are already working in the community by mobilizing young people in that particular community. And I must say that it was really difficult at the beginning to engage young people in TB agenda, because it's not that easy to engage new people who never had TB, young people who have different interests and different perspectives. So it was really difficult, but we kept developing new approaches, new model of youth engagement, such as we used sports to attract young people and then mobilizing them in TB advocacy. We use arts, we use music. We also provide training to young people, to provide learning opportunity to young people so that they can grow themselves and they can contribute to the society. So I strongly believe that it's high time to adopt the Global Youth Declaration to end TB at national, subnational, and community level, and implement WHO 1+1 Youth Initiative at all places. And I strongly believe that I look forward to see such initiation from all the countries, and we will be able to develop a huge network of young people, 10,000 youth all around the world together. And I strongly believe that if trained young people, empowered young people work together, we have 10 more years to achieve NTB strategy, and I strongly believe that we can achieve NTB strategy by 2030. Thank you.
Thank you very much, Madhusudan, for your young energy, for your passion. And dear colleagues, I would like to let you know that all this work, engagement of thousands of the young activists into the movement, trainings, knowledge sharing, and all the activities were provided without any financial support. And these people, young people, are ready to do more. They're interested in making difference in the life of those who are suffering. The idea of the 1+1 initiative, that at least you can reach one person with the support, at least you can share knowledge with one student, your friend and a fellow about problem of TB. One small step can make a huge difference. With this, you can reach millions. And the good example, and you can see it on the video, which is now ready, and I would like to present it for your attention, please.
It's time to
young people dying and crying, don't you still realize it is true? And someday you gotta fix this mess. There'll be a disgrace. Raise your voice all over the place, singing we will end TB. We will end TB. We have to have a heart into this. Let's take a note for the better place to live someday. You gotta fix this mess. There'll be a disgrace. Health coverage all over the place, singing we will end TB. 2030 is what we chase. Don't be a disgrace. Show your palm to the world and sing. Singing, we will end TB. We will end TB. We have to have a heart into this. Let's take a note for the better place to live someday. You gotta fix this mess. Don't be a disgrace. Health coverage all over the place. We will end TB. We will end TB. We are young people keeping hopes in our eyes. Gonna make this world TB free someday. 2030 is what we chase. Don't be a disgrace. Show your palm to the world and sing. We will end TB. We will end TB.
Bravo, bravo, Madhusudan and our young colleagues. You inspired us a lot, and I think no one in this audience and beyond has doubt that we will end TB. And with such amazing young people and young champions, I think that you should and you will be able to support in this situation with COVID, but please don't forget about infections control and to avoid any risk of being infected or transmit infection to those who are most vulnerable. Okay, thank you very much, and I no doubt it will be continued. Now, but it's not the end. It's not the end of our talk show. We are moving to another speaker, Dr. Philippe Duneton, Acting Executive Director of the Usaid. So Usaid is leading efforts on innovations to end TB. They are supporting critical projects, especially on country scale-up of TB preventive treatment in children, household contacts, and those at risks. This is being promoted through our recently launched guidelines. Please, Philippe, share successes and challenges you have experienced in this area, as well as your support in the rollout of innovative diagnostics, wider use of the best new drugs for adults and children, and new digital technologies. Innovation is critical to save lives. I know that Philippe had to move to another important call. I'm wondering if he's still with us. So we hope that if he's not responding, I believe that he can join us later, but I would like, even in his absence, to acknowledge really very important work. Research and innovation should be continued, even now, even in this challenging period of time. So I am moving to another speaker, Dr. Sachdeva, Deputy Director General of the National TB Elimination Program of India. India, as you all know, is the highest TB burden country in the world. However, the commitments of the senior leadership and progress is really amazing. So, and we know that Prime Minister himself is committed to end TB by 2025. Innovative approaches, including digital technologies and public-private partnership, have been vital to close gaps in care. Dr. Sachdeva, please share with us the strides your country is making to keep the promises of the high-level leadership, and especially now in the midst of the COVID-19 pandemic. Dr. Sachdeva, hope you are with us.
Thank you, Teresa. A very good evening from India to all the panelists. You already alluded to India being the highest TB burden country, but having said that, now we are also contributing the disproportionate numbers in the TB notification, much higher than what our percentage of disease burden is, and thus trying to close the gap between the estimated number of TB cases and those who are notified. We also have a highest political commitment from none other than the Prime Minister of India. So what this political commitment actually means in real terms to the program. A lot of provinces in India, 36 in all, are committing one by one to eliminate TB by 2025 based upon the clarion call given by the Prime Minister of India. So as on date, 12 provinces have committed that they will eliminate TB from their own province by 2025, some earlier than 2025. In real terms, this means they are committing additional resources, both in terms of manpower and also in terms of finances, over and above what the central governments and the provincial governments are providing for TB control. So this is a clear buy-in by the political commitment. The other thing is that with this political commitment, a lot of multi-sectoral and intersectoral coordination, which is actually taking shape on the ground, which is exemplified in terms of various ministries joining the TB elimination efforts, Ministry of Railways, Home Affairs, Finance, the indigenous system of medicine, defense, so on and so forth, and some of the corporates, the public sector undertaking as well as the private sector for-profit organizations. So they have started contributing in their own small way to TB control, more specifically within their local area, but this all is pulling into a huge resource and also advocacy within the community on TB control. We have seen that in the last 3 years, we are closing the gap between what we used to talk earlier about missing million. So now that missing million is somewhere missing 1/3 of a million. We closed almost 2/3 of the gap of the missing million. We are hoping that either in 2020 or 2021 should be an inflection point for TB program in India, where we should then start seeing a rapid decline in incidence. Having covered reached almost all those who are expected to have TB within our country, and offering them with quality assured services, both for diagnosis, treatment, and in a span of time which cuts down their risk of transformation. But these are challenging times, as we hear about. We see an increasing case notification also from another infectious disease, which is COVID-19. How will it affect TB programs? Saying that it will not affect all would be a wrong statement, but we at the program are very confident that it will not affect TB program and other public health programs to an extent which we are imagining ourselves. Because having learned previously from our own implementation, as well as seeing the response from other countries in the globe, we are well positioned to respond to this epidemic. The guidance on how to handle TB and COVID together, based on the current knowledge which is available with us, we already issued guidance and instructions to the states and districts on how to approach patients, how to make logistics available, how to make these services available. And there is a clear understanding now with us that during this lockdown, if a patient is stuck in some other district other than which he originally belongs. We will make the drugs and the treatment as well as the diagnostics available as close to the patient as possible. And if the patient cannot travel at all, we will see that how we arrange to send those drugs to that patient's wherever he is staying. But there is also an opportunity in this whole COVID-19, which we are seeing a huge gain in terms of huge advocacy for airborne infection control, respiratory protection, cough etiquette, the realization that you can get something to air, and your personal hygiene. So what the TB program was struggling for years to implement airborne infection control measures within the general health system is actually getting a huge, hugely grounded within the psyche of the general health system, within the policy makers, that they need to address airborne infection control if they have to prevent the respiratory infection. And TB is also one of the respiratory infection, which is more chronic. COVID is more acute. So it's also a lot of advocacy, indirect advocacy for infection prevention and control. And this indirect advocacy will also translate into some investments. When I say some, almost I assume modest degree of investment into core areas of infection prevention and control, including changes in building design and some amount of civil works to make these areas compliant with airborne infection control norms, and also a change in behavior of patients and healthcare providers towards personal protection, and the hygiene, the personal hygiene. So these are few opportunities within the COVID scenario. Also, the patients, the general community remains the same. The vulnerable, whosoever is vulnerable for TB, also remains vulnerable for COVID. So all those with comorbidities, whether it's malnutrition or poverty, or they are crowded slum places or urban slums. So those the comorbidities and the social determinants remain more or less the same. So addressing COVID is also indirectly addressing some part of TB control, though it's throwing challenges in access and logistics. We also hope this lockdown and other things will cut transmission of both COVID as well as TB. I mean, even for a short period, this should translate into some gains on reduction in TB infection and TB incidence. The other things, the government also launched a campaign which is called TB Harega Desh Jeetega, which means TB will lose, the nation will win. It's a huge campaign, also called Accelerator to TB Elimination, which was launched by Minister of Health about in September 2019. Has few components. One of the main component, the first component, is community engagement. And we have seen, Nandita just spoke, the first speaker, she referred to her speech at the UN Assembly. Drawing from that, we are hugely investing in communities now. All our districts have TB forums. We are also now trying to make them, empower them to respond to the local community needs, do some sort of community monitoring about the TB program. We are also looking at Global Fund supporting some of these initiatives in its next round. We are also actually leveraged on Global Fund savings from the current grant to get some resources for COVID-19. We have bought some equipments out of TB funds for COVID response to the COVID. We are also dedicated our entire call center operations to COVID-19 response. Some of our HR, we are capacitating them to respond to clinical management of should there be a need on this. Having said that, I also saw some of the speakers, specifically Teresa, yourself, and DG WHO referring to all oral regimen, TB preventive therapy. These are core focus area at the TB elimination program now. Just to let you know, all our provinces are now implementing all oral regimen in the country. If I look at the districts, almost 80%, all 36 provinces are implementing. 80% of 700 odd districts are actually implementing the all oral regimen. We will see that in next month or so, it's a pan-India coverage in the entire districts of India. On TB preventive therapy also, it's very high on our agenda. We are expanding the age group to which we will be offering the TB preventive therapy. As you all know, the once weekly rifampicin regimen has also been approved by Drug Controller General of India, and we will soon have that drug availability within our country. We can place orders, get that drug within our country, and we are shortly going to do that. So huge investments within TB preventive therapy. You'll also see in some of the Global Fund proposals which will be posed for funding. So this will see some traction in the years to come. A lot of traction, in fact, we will see in the years to come. Also, there are huge successes in the past on TB control. The name one was on the establishment of a huge infrastructure to respond to this TB epidemic. So more than 100 liquid culture laboratories. We now have 3,000 plus molecular diagnostics in the country. So we are practically now moving to replacing square microscopy in a very short span of time. We are looking at less than a year time frame to replacing square microscopy with the molecular diagnostics. That has been a huge success at the TB control program. Other huge success has been engagement with the private sector. From about 4,000 cases in 2012, in the year 2019, we saw 700,000 cases being notified by the private sector and being followed by the public sector program for their public health outcomes. So there may be some gaps in the public health action. We are at it. We are seeing to it that we keep on delivering those quality services, keep on engaging with the private sector. We also look at active case finding as a huge opportunity, not only for increased detection, but also for passing on the messages of core TB elimination, TB care and control, each and every household which is visited by the healthcare team. The concept of TB-free districts, TB-free states is gaining huge traction. We already had one reference from one district claiming that in last 2 years, he has been able to demonstrate 20% reduction in incidence. We have instituted awards for states and districts in a sequential manner. If you demonstrate 20% reduction, you become eligible for a bronze award, 40% reduction for another award, 80% reduction, you get a silver, and TB-free, you get a diamond award. So they have been instituted. We are seeing some traction already, a healthy competition between the states, and they are now coming forward to claim those things. We have to still develop a protocol and test it out in the field. How do we validate those claims, which we will do in next 3 to 6 months. But these are very, very positive signs which we are seeing under the program. We are also keeping an eye on latest development, new drugs coming on the ground, Predominant being likely to be available. Bedaquiline and delaminate have already been adopted under the program. They have been scaled up. So we keenly await also the latest developments in both in the treatment field, in the diagnosis field, also within the service delivery, and look hugely at innovation supporting program, digital interventions, taking things to scale and reducing the work on our human resources, and look from guidance from all other panel members to make dream of TB-free world a reality. Thank you.
Dr. Secheteva, many thanks, and you are doing a great job with your very strong team and jointly with the partners and civil society. Of course, you are facing challenges as all of us, but I hope, I believe that all your work will not be affected, and we will join you as WHO and other partners to provide sustainability and to avoid some crisis and limitation in the access to TB care. Let's discuss further what could be done, but you know that the global progress without progress in India is simply impossible. That's why we are together. Please never give up, but I no doubt that you will continue. So with this, I heard from the colleagues that Dr. Philippe Duneton joined us again, and I am addressing my question to him again. And Usaid has very special mandatory and portfolio. They are leading, pushing innovation, and their soonest implementation in the practice. It's critically important for TB, and they are leading efforts in many important areas, adherence for the treatment, in the preventive treatment, new tools, innovative approaches in the digital technologies, MDR, TB. Philippe, please tell us what is your focus area now in this crisis, and give us share with us some good news. Philippe.
Hello, I hope you can hear me, and good afternoon, Teresa, and thanks for the invitation. And thanks everybody to join us. I think that we all are saying that, yes, we are facing a very different situation now with the COVID-19, but it's also a reason to focus on the current threat and to make sure that we can fight and continue the fight against TB. Several people, and of course the DG Tedros said that this TB is, of course, curable, treatable, and preventable. And I will maybe focus on that for a couple of minutes. I think that we have been with partners, but really pushing the agenda to prevent the development of TB for people living with HIV and case contact. We have now an agreement with not only Sanofi, the originator, but also with generic manufacturers. We're expecting to have the treatment available for at least 2 million of people in the coming month. So it's quite important that at country level that there are these tools and that people can benefit from that, especially with the issue of COVID-19, because of course, as it was mentioned several times in by Lucia, that the symptoms of a beginning of TB and COVID-19 are quite similar. So that's a reason, in addition to prevent TB, that we need to make sure that people get access to that, which is quite important. I believe that we also, as Usaid, are very concerned about the potential impact on the health system, and of course the current intervention that we support as Usaid, but globally speaking are doing, especially in the most affected countries with TB. So we also want to reassure that the people and our partners and our grantee that we will continue to help them and to help the country, not only with TB, HIV, or malaria, but also to see how the resource and the capacity they have at country level can be used also to address that pandemic. I think that already it was mentioned, but yes, the network in TB and other area for diagnostic can be also part of the response in COVID-19. We also think that in terms of tests, but also thinking about how to increase access to tools that can check and identify a severe case of pneumonia, and maybe access to oxygen, and to contribute to that is something that will be key. The challenge is the time, because we basically have no time to support the country, but we will do our best again with WHO and the program and the TB program to address at our best. Thanks, Teresa. Over to you.
Philippe, thank you very much for your very proactive position. I know that you raise many important issues, and now working closely with WHO and other partners, try to highlight the most urgent needs and try to contribute in them. Really applaud to you, and we hope we will continue working together as effective and even more effective as we did it in the previous period of time. Thank you very much. And I would like to give the floor. Time is running so fast and we have so many important speakers. I would like to give floor to Dr. Ibrahim Abu Bakar, Director from the University College of London and Director for the Institute for Global Health. Ibrahim, it's good that you are with us today. I know that you are also extremely busy and had to leave us very soon. We have had a privilege to work with you for many years. You are our staff chair and leading expert on global health research. Please share your experience, your views on how we can accelerate efforts to end TB, particularly in this situation to reach underserved population. We look forward to your wisdom, please. Ibrahim?
Sorry, I was on mute. I shall unmute now.
Shall.
Excellent.
Good afternoon. I'm Michel Kazachkin. I come from the global
so many
health
thanks for the
field,
opportunity to put this
I'm
intervention
calling in on the call from Geneva, Switzerland.
On World TB Day. I'll start by saying the global effort to tackle TB has gained momentum over recent years, supported by high-quality research with palpable progress, especially around diagnostics and innovation on treatment for latent TB and drug-resistant TB through shorter regimen. We're also making progress on new vaccines through the seminal publication in the New England Journal recently. Through the leadership of the WHO and TB research community supporting this effort, we have a draft WHO global strategy on research and innovation that outlines key opportunities. What we need is now for leaders to sign this off, and I'm delighted that both Dren and Tedros are listening to this. We need this document to get out and to get out soon. We also need the right level of advocacy to get it fully funded. I'm particularly concerned that there is a risk that with the global attention being diverted, we wouldn't be able to get it appropriately funded. So the impact of all of the discoveries that this would underpin in terms of identifying new tools and the subsequent implementation will be the key difference between success and failure for the global TB control effort. Therefore, it is important. Research is not the extra add-on, but the key issue. I want to address the two key issues that Tresa has raised in her question. First, drug-resistant TB. This is a preventable and avoidable cause of morbidity and mortality, affecting over 500,000 people annually who suffer from MXDR TB. And it requires us to keep momentum, the momentum that has been hugely that is needed to implement all oral short regimen in securing even shorter effective treatment, as well as in ensuring that we access the tools that are needed for diagnosis and preventing the transmission of drug resistance, including through vaccines and the treatment of latent tuberculosis that is appropriate for individuals who have drug-resistant strains. There are so many good stories on new tools. There is a shorter regimen that exists in this area, and what we need really is action to get it to everyone who needs it. It is important that across the entire story of the wider drug resistance initiative that both the WHO and the national governments are prioritizing, we see MDR-TB as indeed the seminal example of drug resistance. MDR-TB is drug resistance writ large. The second issue is the issue of underserved populations and the importance of those populations to the global TB population and control. We all know that TB can affect any one of us, but even where TB is very common, it disproportionately impacts the most vulnerable in society, either because they have more transmission or because they are the least able to access diagnosis and treatment. This issue challenges rich and poor member states alike and is more pronounced in settings where resources are limited, even if our voices in the global north is louder. Research has a major role to play in tackling the needs of these communities, including, in particular, vulnerable migrants, homeless individuals, minority groups, and those with a history of problem drug misuse. We have shown through careful evaluation of the Find and Treat initiative in London that it is possible that when you do appropriate innovation and deliver services to these communities, you can tackle TB. We utilize mobile digital radiography, peer support, and video observed therapy, indeed, and whole patient support approaches. And the evidence is very clear, you can make a difference. Furthermore, supported by the European Commission, we've extended this to places such as Bucharest, where our intervention in the eDetect TB program is making a difference. I know there are numerous initiatives globally that are providing patient-sensitive, appropriate approaches to vulnerable communities. Our humanity is defined by our ability to care for the vulnerable. Addressing the needs of the vulnerable populations is indeed the most enlightened self-interest approach. So we need to do the research needed to underpin the care for these most vulnerable groups. And the time to do it is now. I'll stop there.
Thank you. Thank you very much, Ibrahim. As usual, very strong and concrete statements with the clear actions which should be undertaken as soon as possible. Of course, we are all very frequently explaining some concerns and complaining that we have no enough tests, point of care tests, no enough drugs, but if you will overview, we have enough effective tools and drugs. What we have lack of sometimes political will, we have a lack of understanding of the real threat and real burden. And once it becoming like a pandemic, we are all involved in this situation. And let's learn once again these lessons from this crisis and to think more about so-called old diseases, or old epidemics, and try to solve them as soon as possible. Thank you, Ibrahim. And now I am moving to the next speaker, Executive Manager of for the Strategic Research Initiative, South African Medical Research Council, Dr. Naresh Bhagwandin. And my question to you as a respected researcher is, first of all, great to have you with us. And I would like to ask you, we know all that South Africa is one of the pathfinders in the research-related activities, in the clinical trials. We ourselves, Global TB Program, benefits a lot from your data. You are sharing actively, and it's an excellent example for the country. Active data sharing should become our daily business. And now again, with this crisis, we are looking at South Africa with the hope and expecting some new evidence about COVID and TB treatment and cases. Please, what can you tell me about your situation and your plans?
All right. Thank you, Teresa. And thank you for inviting the South African Medical Research Council to this talk show. So I'm standing in for the president of the council, Professor Glenda Gray. Unfortunately, we are facing a lockdown in a couple of days' time, and she's been called to attend to other matters. So I apologize on her behalf. So greetings all from Cape Town. We are facing a difficult time in South Africa and in many other countries around the world. So as you know, South Africa is one of a handful of countries responsible for the majority of the world's TB burden. And given our HIV epidemic, the largest in the world, and increasing rates of TB incidence and prevalence, finding solutions to end TB in South Africa, and for that matter, globally, is an extremely high priority. And as you would know, there are several world-renowned researchers and research groups in South Africa, as Teresa has alluded to, and they're conducting cutting-edge TB research, whether it's basic research, clinical implementation, operational, So we have some world-renowned researchers, and because we have the patient load, we have developed a lot of excellent research. We have a number of research groups at universities. We have research organizations. The South African Medical Research Council conducts TB research, and we also fund research, and a number of extramural units are doing TB research. So if you look at a bibliometric analysis, and it shows that the publications emanating from South Africa have a very high citation count. So in terms of volume, we may not have the highest volume of publications, but in terms of citation counts, we rate very highly. So I wanted to use this opportunity to mention a recent development, and that is the Brics TB Research Network, which was established in 2017. And this was a decision of the ministers of health from the Brics countries. You may be aware that Brics countries carry a disproportionate burden of TB, and the goal of this network is to establish collaborative research programs across the Brics countries. So at one of our meetings last year of the network, South Africa proposed a TB Innovation Summit to be held in Cape Town in April of this year, and hosted by the South African Medical Research Council. Unfortunately, we had to cancel this meeting last week due to the ongoing transmission of coronavirus and the restrictions on local and international travelers. We haven't made a decision to reschedule it as yet, given the uncertainty regarding the virus. So the goal of the summit is to bring together scientists from the Brics countries to brainstorm and propose ideas with the aim of developing new products, particularly, and we're focusing on diagnostics, vaccines, and digital health for the summit. And we are proposing that the outcomes would be 2 to 3 new innovations in either diagnostics and or vaccines, and that the network can prioritize for investment, investment and development. The second outcome was to propose a roadmap and milestones to achieve these innovations. And thirdly, to come up with a funding strategy to support research activities of the network. So we were at an advanced stage of planning the meeting, and unfortunately last week, I had to inform the potential participants that we had to cancel. So we're looking to reschedule, but we don't have a date yet. South Africa has also just concluded the first TB prevalence study. It's taken 3 to 4 years, and the report will be presented to the Minister of Health shortly. I believe these findings will inform research priorities and new strategies to address the burden of TB in South Africa. So with that, I would like to end my talk.
Thank you very much, Naresh, and thank you very much for mentioning Brics research activities. As you know, recently, just before this crisis started, we had Brics TB Research Network meeting here in Geneva, and we are proud as WHO that we are providing support to its Secretariat, and we will continue doing this, the hopes of the whole world with the Brics countries, because you are not only highest burden countries, but you have a lot of advantages and capacity, and I hope that you will bring some innovations and we will implement them as soon as possible. Thank you very much, Naresh. I am wondering if Mrs. Hiwot Solomon, Director of the Disease Prevention and Control Program from Ministry of Health of Ethiopia, is still with us, because I heard that there were some problems with the connection. Could you please respond if you can hear us? Okay, seems unfortunately that there are still problems with the connection. Now I am moving to another speaker, and she is not ordinary speaker. She is also, actually I have all the very good friends and colleagues with me. It's not because I selected them, because we are working close with all key stakeholders, partners, and simply with those who would like to contribute in the fight against TB. So I would like to give floor to Mrs. Evelyn Kibuchi, WHO Civil Society Task Force member. And I would like to let you know that we launched not only our guidelines, we also launched a brochure with the highlights of the meaningful contribution of the civil society task force in the work of the WHO and in the response to the TB in their respected regions. Evelyn, I would like to ask you a question about your work in your country, in Kenya, through Stop TB Kenya. And please tell us what are the main challenges and problems, and what are your efforts, and how, even in this situation, civil society can be engaged in the activities. Please, Evelyn Flores.
Thank you very much, Tresa, and greetings from Kenya. I would want to summarize the civil society perspective in an analogy. In 2018, January, a woman conceived, and in September of that very year, she delivered a bouncing baby boy. And as it is expected, there was a midwife to help the mother deliver safely. And of course, there were friends who brought gifts. They were excited about this bouncing baby boy. And the father, having been the firstborn baby boy, was very excited. And he actually made commitments and signed that he was going to avail resources to ensure that the baby grew to be a mature, independent man. For those of you who have been with us in TB response, by now, you know what my analogy makes reference to. I'm talking about the United Nations high-level commitments that were signed in 2018, September. And who is the midwife in this case? The midwife is the Ministry of Health, the NTP managers, who, after ensuring that the declaration were delivered, of course, they had other competing health issues to address, and also other issues that they had to. So they could not continue supporting as they started. Secondly, who are the friends? The friends are the other stakeholders who are with us as we developed the commitments, and even when they were signed. But like the ministries of health, they also had other competing needs to look into. And who is the father? The father in this case is the heads of states who are very excited about this bouncing baby boy who had just been delivered. And they made commitments and they signed on to declarations that they were going to avail resources to ensure that this baby grew to see the light of day and become a mature man. And now we come to the mother. Who is the mother in this case? The civil society organizations. You all realize that all these other stakeholders, they come and go. The governments change hands, the NTP managers change. The other stakeholders also have other competing needs. The only unit, the only institution that is left to carry the vision are the civil society organizations. But the civil society organizations, therefore, as a mother, have the responsibility of, one, ensuring that the baby meets all the milestones that the baby needs to meet to prove that he's doing well. You also need to ensure that the baby receives all the immunizations and vaccines to be healthy. That's why we are very excited when one of the previous speakers talked about the availability of the TB prevention therapy, because that is one thing that the baby will need to become healthy. Number three, they will need to ensure that the baby lives to have their human rights upheld. However, for all this to be achieved, the civil society we need three things. One, they will need to be involved in all the processes of the TB response, which include planning, all the policy-making processes, all the evaluations. We need to be, as civil society, we need to be involved all through the processes. And at this point, I really want to appreciate WHO for recognizing the role of civil society in the TB fight and creating the civil society task force wing of WHO, which I'm part of. I also want to appreciate the National TB program in Kenya with the Ministry of Health, who have actually recognized the role that civil society play in TB response, and they have actually ensured that we are involved in all the processes, the policy-making process at the country level. When we are developing the strategic plan, they ensure that there is civil society and even infected communities represented in the process. Number three, we'll definitely need resources. We have a huge gap in resources, both at the global level and much more at the country level. The role of the civil society organizations need to be recognized and adequately funded, because we are an integral part of TB response in the country and even at the global level. And number three, remember the father signed a declaration and committed to avail resources. We shall ask the fathers to avail the resources as they committed. As I end, for the civil society organizations in the house, and even those who are not available today, where I come from, when a baby does well, the father takes the credit. When he doesn't do well, the mother takes the blame. I will end with that. Thank you very much.
Thank you very much, Evelyn. Thank you for your kind words, for your important highlights. And as you see, we here in WHO, we took very seriously your requests. Nothing for us without us. And we are following this request. And I think this is the only right way if you really would like to meet the requests of the vulnerable people. So time is running very fast. We actually used a little bit more than we expected in the beginning, but it was very rich discussion. And I would like, by the end of the second panel, ask to respond quickly in one sentence, all our speakers, what it is time for when we're talking about it's time to end TB. Please, a quick response for the second round of panelists. Who will be the first?
Okay, it's Niresh in Cape Town.
Please, Niresh.
So it's time to mobilize resources, innovate, and make impact.
Great. Madhusudan.
Yeah, it's time to engage young people and endorse WHO's declaration to end TB at all national and sub-national levels.
Thank you very much. Very good. So, Philip.
Yes, thank you, Teresa. I think that it's time for prevention. We have the tools now to prevent development of TB, which is something very, very important. It's also time for prevention to take care and protect the people from COVID-19. So I think that's prevention is the key word for today.
Absolutely agree. Prevention, future is for the prevention and for the prophylaxis. Absolutely agree. Evelyn.
For me, I will end with it's time to take up my role. It's time to take up your role in the fight against TB. Thank you.
Absolutely right. Dr. Sachdeva, if you are still with us. I think that Dr. Sachdeva is already engaged in his daily work. As he explained, he had to do a lot of things, urgent things, and we fully understand this. And by the way, acknowledge time of all of you. And we know very well that all of you are very busy in this special time. So we are looking at our audience, it's continuing to grow, and we received a lot of questions. Unfortunately, we can't respond right now as we planned, because there are not just a few questions, and we are planning to respond via social media to this question. So coming to the end of this very important and exciting talk show, I would like to give the floor again to WHO leadership, and the whole talk show with us is Dr. Dren WHO Assistant Director General for UHC, Communicable and Non-Communicable Diseases. He is head of the division in which Global TB Program work is housed under, and he himself champions anti-TB efforts with unwavering support. Dr. Dren, would appreciate your wrapping up of these events and your always encouraging speech. Please go ahead.
All right, thank you, Teresa, and also thanks to all the speakers and friends who make very good intervention. This has been a very interesting and interactive virtual event with excellent intervention made by distinguished speakers from countries, affected peoples and communities, civil society, partners, and researchers. As highlighted by all the speakers, we understand we need to ensure that the spotlight on deadly disease like TB should be maintained despite crisis like the one we are experiencing now with COVID-19. This is critical to ensure no one, especially those most vulnerable, are left behind. This is the cornerstone of WHO's pushing to the universal health coverage. We need all stakeholders engaged, and we need sustained financing and more research. Civil society and youth can help us to make response business as usual. It's time to wrap up this session, unfortunately, but we can't wrap up our efforts until we end TB. That remains the world's top infectious killer. Millions of lives depend on success of collective efforts to accelerate the TB response, especially in times of crisis like those. We cannot let them down. World TB Day this year is crossroads for the fight to end TB. We need to unite forces to take the path of success that will save the lives and end suffering. Our vision is that no one with TB will miss out on the care they need. WHO will stand by every country, partner, society, or persons that decides TB has no place in the future. The clock is ticking. We cannot lose another second. There has never been a better opportunity to make TB history. It's time to deliver our promises. It's time to end TB, and we will end TB at the sound we hear. So thank you, Teresa. Floor is yours.
Thank you very much, Dr. Dren, and thanks to all our distinguished speakers and our very active and growing audience for joining us at this first talk show on TB. Please continue to stay in touch. We are stronger together, especially in this time of challenges. Together, we can combat diseases. We can overcome a COVID-19 crisis. We can end TB. We can't say more today, but we definitely can do more. I wish you all, your families, and all the millions stay safe and healthy. Thank you.
Thank you, Teresa. Bye.